So knowing a person's activation is really important in terms of guiding that successful care and understanding where they are on that journey of self-management with their chronic condition. The next slide, please. The PAM, the patient activation measure, is the tool that reliably predicts patient behaviour, such as unwarranted hospital visits and admissions, care experience, medication adherence, all sorts of health outcomes. We now have this scientific empirical tool that can measure where a person is on that journey of patient activation. Next slide, please. That tool looks rather simplistic, and it is, but there's been a lot of research over the past 10 to 15 years on the tool. It uses a very distinctive analysis technique called RASH. Each question gets more difficult to answer in the strongly agree, and it's been carefully structured over many years. It was a bank of, I think, of about 120 questions at one point, and now it's been reduced down to 10 with very strong reliability. It assesses 3 key domains of patients' knowledge, skills, and confidence, and it's able to generate a score from 0 to 100. We also are able to collate those scores into an activation level. So we often talk about people's activation being low or high in terms of level 1, 2, 3, 4, where 4 is high and 1 is low. And we'll hear more about that towards the end of this presentation. Next slide, please. What PAM is and is not. It has elements of ready to change, and it also has elements of motivational interviewing, but it's not just that. It's not a personality profile. It's about measuring, as I said before, knowledge, skills, and confidence. And we don't even really refer to it as a questionnaire or assessment because these things usually use psychometric analyses, whereas the PAM is actually a set of statements that can reliably predict a person's behaviour. Next slide, please. And that therefore leads to an approach is that we need to measure reliably, just like we do blood pressure or someone's temperature, that we measure and then we look at, okay, this person's at this level with their PAM score, what do we need to do? And over these series of 3 to 4 webinars, you'll hear more about what do we do when we know someone's PAM level. Similarly to what do we do when we know when someone's temperature is at a certain level, or their blood pressure, we know what to do. Well, we need to know what to do when we understand a patient's patient activation level. Next slide, please. And as I mentioned earlier, there are 4 activation levels that are empirically derived. So what that means is, and this is very important, it means that each point on that 100-point scale is an equal interval scale, just like temperature and blood pressure and those measures. So we know that a movement from a score of 30 to 31 is similar from a score of 80 to 81. And more importantly, we know the value of a single point change in a PAM score is significant and well understood. And we'll talk more about that as well in these slides. Typically, a population would have about 40 to 45% of people who are lower activated in terms of managing their chronic conditions, and about 50 to 55% of the population would be higher activated. What we want to know, obviously, where everybody is on that journey, but you will see that there's real leverage to be gained by working with those who are lower activated. And it's probably those in your practice that you may be struggling with in terms of getting some movement, and they keep coming back and not much has changed. And you keep trying and in a sense pushing, but getting some resistance. And we're going to see what that looks like. We've got some videos towards the end of this presentation for you to have a look at that. Next slide, please. I mentioned the value of a single point change. There are hundreds of studies that describe this. You can see in this diabetes studies that a 1% change in a PAM score resulted in a 1.7% decline in hospitalisation and a 3.4% gain in A1C testing and LDL-C testing. So, and on average, people will move, if they're lower activated, about 10 points. So we can expect a 17% likelihood decrease of hospitalisation, those in the diabetic study, and there's a study there on HIV. We'll hear more about that as we move through the slides in terms of, so what if I move someone along their activation? What does that mean in terms of health outcomes and in terms of resource utilisation? Next slide, please. We know this is a study based on 184 client organisations. Some of those organisations are very big, like Kaiser Permanente. This is involving about 1.5 to 2 million patients, and they involved organisations that panned their patients at least twice over a 6-month period. And you can see there the lower activated patients, level 1, on average move around 10 points over that 6 months. It gets a little less as you move up the activation level, but the lower activation ones, about 81% improved when they did their second PAM testing within the 6 months. Obviously, there are those that are intractable and don't change, so it was about 8%. And as we move down, you can see that everybody's moving forward except level 4, the higher activated. Why do they move backwards? Well, they're already at a higher level, and it's really hard to keep maintaining that higher activation level. The good news is they don't move from a level 4 back to a level 3. They may decline 4 points, but they may already be at 85 points and move back to 81, but they're still within a higher activated level, and we'll talk more about that during the course of these webinars. Next slide, please. There's been a bit of work in primary care, at least in the UK, and they've been able to start to segment their population using the PAM and map that against medical complexity or acuity. And they've been able to see that, look, those who are higher activated and low acuity, we don't really need to do a lot with them. They're fairly self-motivated. We only need to point them in the right direction, refer them to some resources, and they go and do it. And we know they will because we know their PAM level. Whereas what we really need to do is start to look at those who are lower activated and have high complexity needs, and how do we work with those in a different way. Next slide, please. This piece of evidence, it was only a small study with 7,000 patients in 5 primary care practices, but they found that it was a retrospective study. The GPs who had higher activated patients tended to use a lot of different strategies in supporting patient behaviour change, things like identifying small steps, emphasising patient ownership. You can read those there. And those GPs who had lower activated patients were using far less of these skills. And these are some of the skills we are going to touch on during the course of these 3 to 4 webinars. So when you know what a person's PAM level is, what do you do? That's what we want to focus on. But at the moment, we're just giving you a breadth of the science behind the tool and behind the concept of activation. Next slide, please. You can see here that this is a major study looking at preventable hospitalizations. And you can see there that those who are lower activated, PAM1, have a 62% more likelihood to have a preventable hospitalisation compared to a higher activated patient. It improved in the second year to 40% more likelihood because there was some work done with those patients. So this is quite a significant statistic, that the likelihood of those lower activated patients having high resource utilisation is demonstrated by this graph. Next slide, please. Even things like the risk of a future chronic condition diagnosis resides in patients with low inactivation. You can see here that lower activated patients, PAM level 1, are 51% more likely to have a new chronic condition diagnosis 2 years later compared to a higher activated patient, a level 4. So again, it's important to know who are our lower activated patients so that we can work more closely with them and help move them those 10 or so points and hopefully bump them into a level 2 activated patient. Next slide, please. This was a recent study late last year where done by the Health Foundation, a big population of patients. It was about 10,000. And they found that if we could move people from a level 1 activation, a low activation, to a level 2, it would probably prevent about 330,000 emergency department admissions and 504,000 A&E attendances. And they felt that this is about a 5 to 6% reduction across NHS England. And you can see there that the difference in healthcare utilisation is markedly so for lower activated patients compared to higher activated patients. Next slide, please. And self-management behaviours do vary, as I've been alluding to, significantly by activation level. So things around lifestyle changes such as exercising, or things such as taking treatments as recommended, or undertaking preventative programs like mammograms, pap smears, bowel cancer screening. Always you'll get this sort of profile where higher activated patients are much more likely to undertake those healthy behaviours, whereas lower activated patients are not. So the science is rigorous. What we need to do now is being able to measure, and then we need to be able to think about what do we do now that we know their PAM level is, just like any other clinical indicator, really. Next slide, please. We're going now to move. That's a quick run through of the science. There's a lot more. There's over 450 peer-reviewed academic publications, and I just gave you a brief taste of that around the science. And you might be asking now, what does a person with low activation look like, or a person with higher activation? Evidence showed that GPs felt nearly 100% confident that they could guess what a patient's activation was just by working with them without measuring, but the evidence showed that only half of them got it right most of the time. So we really do need to measure this, just like looking at someone and guessing their blood pressure would be a bit silly. We need to be able to measure someone's activation. So I'm going to now hand you over to Professor Larry Baker, and he's got a different accent than mine, and he's going to talk you through and show you some videos about what this might look like. Thanks, Larry.
Michael, thank you very much. Now on the next thing, let's see what these patients at levels 1 through 4 really look like clinically. So we have some videos that enact each number of patients, and they're each speaking to their GP. So what I'd like you to do is just think a little bit about how is it that you think this patient is at what level, if you will. How much do they see that they have a role in taking care of their disease? And by the way, they'll all be patients with a diagnosis of type 2 diabetes. What things are they already confident that they can do to make a difference in their health? And how much do you see them using problem solving? That sort of thing. So make some notes to yourself, and then when we come to the question and answers, we can talk about this or any of the data that Michael presented. So let's go to the first video of Emily.
I've been feeling pretty tired lately, especially late in the morning. I feel like I've got no energy. So it doesn't surprise me that the hemoglobin thing you told me about is up.
Yes, you sound disappointed in that result. Me too. What have you been doing to improve your health?
Well, I saw that nurse you sent me to. She was really nice. But all that stuff she was talking to me about seems like such a bother. Mum has diabetes. I must have inherited it from her. She's 75 now, gets around all right and eats what she likes.
What were you thinking might help you?
I try to take those pills. Maybe they're not strong enough. Maybe I need stronger ones.
All right, so we've seen Emily, and at the end she's saying, maybe I just need stronger tablets. So make some notes to yourself about Emily. How important is her behavior to her health, and what's her confidence and all that sort of thing, and what level do you think she's at? And now let's start the video for Margaret.
I feel tired a lot lately, especially late in the morning. I just don't seem to have any energy. I'm not surprised that my blood test came back up.
Yes, you sound disappointed in that result. Me too. What have you been doing to improve your health?
I saw that nurse you sent me to. She seems very nice and she has me doing all kinds of things. Exercising a lot, cooking differently, writing down every morsel that I eat. But I'm trying to keep track of my diet, but I do eat out a lot, so I keep forgetting to take the book.
What were you thinking might help you?
Give me a jab of willpower, can you? I know I should try harder, but I just can't seem to walk past that shop on the way to the bus after work without stopping and buying myself a packet of sweets.
So we see that Margaret has gone to see the health coach, but the health coach has given her a long list of things that she's still nibbling around the edges of doing. So let's go ahead and see how David is doing in his attempts.
I've been feeling pretty tired lately, especially around late morning. I just don't feel like I've got any energy. So it doesn't surprise me that my A1C test is up. If you have a look at my logbook, you'll see my eating's just been all over the place.
Yes, you sound disappointed in that result. Me too. What have you been doing to improve your health?
Well, now the weather's gotten nicer, I've started cycling with my daughter on the weekends. We went for a lovely spin along the riverbank last Sunday. I've started going to markets, looking for fresher, healthier food.
What were you thinking might help you?
The cycling makes me feel good, but I just don't feel like I'm losing much weight. I mean, how can I keep my blood test steady and lose weight? I know I'm choosing the right foods, but I just can't seem to stop eating once I tuck in.
So we've seen David, and we know that he's trying some things. So again, where is he, do you think, on this journey? What level do you think he is, and how confident is he about what he can do to help manage his health? And now let's meet Graham.
I've just been really tired lately. I've got no energy at all, particularly in the late morning. So I'm not surprised that my A1C is up. If you look at my logbook, you'll see that my diet's been all over the shop.
Yes, you sound disappointed in that result. Me too. What have you been doing to improve your health?
I'm taking lunch to work every day, and I found a good fruit shop on the way home, so I'm getting some good stuff, making some good salads, and I'm definitely getting my 4 or 5 serves of fruit and veg a day.
What were you thinking might help you?
I've been travelling a lot lately. My work's got a new office interstate, and I'm running the transition, so there's a lot of stress too. But I need to get better at eating well in restaurants. So if we grab a late dinner after a meeting near the new office.
All right, so we've seen Graham. We've seen how the challenges that he's encountering and how he's handling them. So again, where do you think he is on the journey of becoming an activated partner in managing his diabetes? And now let's go to our last slide, and then we're going to have a discussion. So sometime during our discussion, if you could fill out an action plan and write down some things that you want to try out when you start seeing patients and you know their patient activation levels. For right now, just start to notice what those things might be. And then over the next 3 webinars, we'll give you more techniques that you can add and turn in that activation level. But for right now, what are you going to do differently based upon your knowledge of patient activation? And then over the next 3 webinars, we'll be looking at some specific techniques. So let's pause with the video part of this and the slide part of it, and then we can do some question and answers for you.